Hi, everyone. This is Yvonne DiVita with PurinaCare Blog and another podcast with Dr. Bill Craig and Dr. Larry McDaniel. And we're going to talk a little bit more today about some claims. We have a case that we can talk about today that involves cats and hairballs. And Dr. Bill, I'm very interested in this because I have a beautiful, wonderful kitty, and she likes to spit her hairballs up on my bed.
Well, that's good. Maybe it's good for your cat, but not for your bed and for you having to do the laundry. And a lot of folks with cats are familiar with hairball problems because that's a pretty common inconvenience or annoyance with cats. Some cats are more obsessive about grooming themselves than other cats. Some cats they have a more meticulous grooming technique. And I kind of refer to it as the odd couple approach to grooming. The Oscar Madison cats are the ones that never groom themselves. They got this kind of rough hair coat and they don't ever have any problems. The Felix Unger cats are the ones that are grooming 24 hours a day and puking up hairballs 2 or 3 times a week.
You're saying that there are cats that just kind of don't spend...
Yeah, the same cats like the ones that get diabetes because they just lay around all the time and don't do anything.
Interesting.
So, sure, some cats are more fastidious and more compulsive about grooming than others. And in some cats, I think their grooming technique leads them to swallowing more hair than happens in other cats. Certainly, the long-haired cats like Persians and Himalayans that have the real fine, wispy, long hair, we see more hairball problems with them than we do in your typical domestic short-hair cat. The ones that have fewer problems are the ones like your kitty that leave you a present on your pillow as compared to the ones that maybe that hair accumulates and builds up to the point that it's too big of a clump of hair for them to get it back out. Mm-hmm. Or in the case of Gabe, and Gabe's just a youngster, he's only 9 months old, but in his case, this hair had moved out of the stomach down into the intestinal tract, which is a narrow one-way street that doesn't have a lot of extra space for things like hair to build up, and sometimes it'll get lodged there. And Gabe's problem, from Mom's perspective, was that he'd kind of quit eating. He was kind of feeling a little blah, just hanging around the house, and then he started throwing up this green, slimy liquid, but not bringing up any food or any other materials. And the veterinarian, when she examined Gabe, found that his tummy was a little sensitive and she could feel sort of a lump or mass in the abdominal area. They took some radiographs, some x-rays of Gabe's belly, and there was a lot of gas accumulation in the intestinal tract. And this is a pretty typical presentation of a patient that has a blockage or obstruction in the intestinal tract. And what happens is that material gets stuck and it can't move any further, and everything back behind it, it'll start to ferment and it'll make some gas and it'll start to swell up, and then you've got pain because of that, and then it backs up until you can't put anything more in the stomach and you start throwing up trying to get stuff out, going the wrong way in a one-way street.
Huh.
So Gabe's owner and veterinarian talked about what are our options here, and the most straightforward approach is to do surgery, go into the abdominal cavity, open up the intestine, and take out whatever it is that's blocking it there. And at that point, you don't really know what you're going to find. You'd be hard-pressed to come up with, in your imagination, all the different possibilities. Corn cobs are common, whole pecans still in the shell. The most interesting thing that I removed from a dog one time was one of those little blue Smurf toys from back in the 80s, the little guys with, they're about 1.5 inches tall. But this little Smurf guy was one that was carrying a flag, and when we took the radiograph, you could actually see the outline of the Smurf guy and his flag on the radiograph. So we thought it looked kind of weird, but we weren't really sure what it was until we actually went in and got it out.
But this is a cat.
Well, right. And so in Gabe's case, when the veterinarian did the surgery, she went in and opened up the abdominal cavity and made an incision in the intestinal tract, and then found this huge wad of hair just packed into the intestine. And she cleaned all of that out, put all the pieces back together, and Gabe was on some medication to help reduce pain and to help promote normal movement, motility of the intestinal tract. And in the medical record the next morning, Gabe was sitting up in his cage purring and wondering where breakfast was. So it's that quick a turnaround.
Now, back in the day, there was something that came in a tube.
Right. That's a petrolatum-based lubricant-type laxative. This is a flavored paste-type lubricant that in cats like your cat that don't have an obstruction but have regular accumulations of hair, this lubricant-type laxative can be fed to them on a regular basis, and it helps to move that hair the right way down the one-way street so it comes out the other end instead of building up in the stomach and causing mechanical irritation to the lining of the stomach, generating nausea and leading to vomiting and ejecting the hairball out the entrance to the gastrointestinal tract. And a lot of folks with cats like yours that have regular problems with hairballs will use these lubricant-type laxatives on a regular basis, maybe 2 or 3 times a week, to help things keep clear and free-running, kind of like putting Drano down the bathtub every once in a while to keep that from getting plugged up.
Yeah, we used to dispense that quite a bit, it seemed, and it was for the groomers. It was for those cats that were always grooming. My cat she's not a long-hair cat, but it's longer than a short-hair cat, so that in between. So she has her fair share of hairballs. Today she was a good girl, and she sit up on the kitchen rug, which is better than my bed.
Well, it'd be nice if she'd just go into the bathroom and throw up on the tile floor or something. But they always seem to find the nice, expensive Persian rugs or the new patchwork quilt that you just put on the bed.
Well, that's the beauty of cats. They find the most
expensive piece of
furniture or product or rug, and they always find the person in the house that comes to visit you that's allergic, and that's the person they want to sit next to.
And folks are always interested in, well, what did it cost to get Gabe fixed? In this particular case, the total cost for diagnosis and surgery was $1,600, and after the deductible and copay, Gabe's mom was reimbursed $1,100, so I'm sure she was relieved that she did have that health insurance for Gabe.
Fabulous. Well, that's certainly another indication that pet health insurance is more than just something you get to help your wallet. It's something that you want to have so your pet gets the best care. And I'm seeing on the net, a lot of people are talking about the benefits, asking about it or saying openly, people should have pet health insurance.
Well, we've got a lot of customers that are really pleased that they have the coverage because these are unexpected and in many cases relatively expensive procedures that they may not have budgeted for and perhaps may not have been able to afford if they hadn't had the insurance coverage.
Well, I think we covered quite a bit, so we will be coming back with more podcasts with Dr. Larry and Dr. Bill, and we'll be hearing more stories, and in between the fun of learning more about veterinary medicine today, we'll talk a little bit about how pet health insurance really does help. Thank both of you today. We'll talk to you soon.
Thank you.